Many thanks for the invitation to participate in this educational activity. I'm going to discuss with you some work that we and others have done in assessing the role of FDG-PET imaging in complications of prosthetic joint infection. For the introduction, we were the first in the world to perform FDG-PET imaging in mankind. This goes back to August 1976, which has been a major addition to our field in nuclear medicine, but in medical imaging. And initially, we did not have the capabilities that we have today, and this whole body image was done with a very primitive instrument that was available to us at the time. FDG has been heavily used since 1976, and we have realized that there are 8 major applications for this very important compound. Although our initial efforts were spent mostly looking at brain disorders, central nervous system disorders, we have realized the importance of FDG-PET in cancer, infection, inflammation, myocardial variability, atherosclerosis, muscle dysfunction, and clot detection. So it's just amazing how this compound that was initially started as a research tool at the University of Pennsylvania now has become a major modality in medical imaging. First, we have soon realized that not only FDG is taken up in brain matter, not only is taken up in cancer tissues, but it's taken up in the inflammatory cells in various diseases and disorders that cause significant accumulation of macrophages and other inflammatory cells. Since then, of course, we have used FDG-PET to look at osteomyelitis and compare the results with white blood cell imaging that is routinely done in nuclear medicine these days. It has become quite clear that FDG-PET is significantly better than white blood cells alone, white blood cells along with bone marrow imaging, as well as structural imaging such as MRI. So this really has been a great application of FDG-PET that will have major impact on management of patients with chronic or acute osteomyelitis. This is just an example of our early work when we compare SPECT gallium with FDG-PET. There's no question that we don't want to go back to gallium imaging when we can get high-resolution FDG-PET images for infection of malignant otitis in this particular patient. This is just a comparison with MRI, where we see very clear-cut evidence of uptake of FDG in inflammatory cells, while findings on MRI are non-specific and cannot be relied upon for optimal management of patients with chronic osteomyelitis. We have been very interested in arthroplasty, both in the knee as well as hip, and since this is a major problem if it gets infected. While incidence is very low, in the first time attempt, it becomes very significant after revision, and 25% of the patients will develop some infection. And detection of infection in these patients is very, very challenging, and therefore there is a dire need for new approaches to make this diagnosis. This is just from our early work showing that there is some non-specific reaction around the neck of the prosthesis, which is not indication for diagnosing infection, but when there's significant uptake of FDG around the body of the prosthesis, as you see here, the lower image, that is very diagnostic for infection and is highly sensitive and specific. This is, of course, a patient who also was suspected that prosthesis infection, but FDG clearly shows in this particular patient is suggestive of subcutaneous inflammation and not infection in the body of the prosthesis. So patients like this could be managed non-invasively without revision surgery, and this really has become a major contribution of FDG-PET in assessing patients with prosthesis. Another very nice case of infection in the prosthesis seen so vividly on FDG-PET, while combined bone marrow and white blood cell imaging was unable to show the presence of infections in this particular patient. This is a patient with skin fistula, and having high-resolution images provided by PET-CT allows you to see very clear-cut evidence about the extent of the disease, how it spreads to the adjacent structures that you could not just adjust, you cannot be able to detect by conventional single gamma emitter approaches. This is just showing you our data where we compare sensitivity and specificity on FDG-PET versus white blood cells and bone marrow. And there's no question that this technology is substantially superior to conventional white blood cell bone marrow imaging. We have done a meta-analysis of the published data, and clearly there is good evidence for just performance, high performance of FDG-PET imaging in assessing prosthetic hip and knee joint infections. Similar to what I've said about hip prosthesis, we see evidence for infection in knee prosthesis. Again, this is going to be in the interface between the prosthesis and adjacent bone, as you see so vividly in this patient. And similar to what I've described about hip prosthesis, the performance of FDG-PET is excellent in this population with high sensitivity and specificity. I just want to mention a few words about diabetic foot, which is another big problem in medicine these days because of high incidence of this disease. And you can apply the same approach and detect osteomyelitis, which is a major healthcare problem in patients with diabetics, and treat the patients accordingly, as you see here in this talus of the bone being infected, but there's also inflammation in the arch of the foot. So based on these data, it's very clear that FDG-PET is very accurate in the evaluation of this serious problem in elderly population. It is very easy to do, and it's much more accurate compared to conventional techniques. And also the cost is significantly lower than combination of white blood cell imaging along with bone marrow imaging. And because of those advantages, FDG-PET may completely replace other modalities in these settings. Thanks again for the invitation.